Have you noticed our life often run in patterns? The late nights that triggers high, the stress that pull you down, and one small choice, and suddenly the all chains reaction starts. This is what we're going to see with Dr. Alina Soto, how to create patterns and how it can help you live better. Alina is the founder of Teradusa and creator of FMPI, a method that bridge body and mind to help people step out of trauma loops and into healing. Helena, can you present yourself?
Hi, yes, thank you for that little bio. Yeah, I'm Dr. Alina Soto, and my main specialty is trauma and traumatic stress. And my approach, FMPI, is a framework that I use when I'm working with patients one on one, specifically with psychotherapy. So, my main tool or my main toolbox that I use is psychotherapy, and the framework essentially allows me to help people navigate the narratives that might be getting in the way of both their change but also their healing.
I will go back to a lot of definition, I think, because at the end of the day, like me, you're probably wondering what is actually psychotherapy? Because we hear this word a lot. And
Mm-hmm.
how do you define it?
Yeah. So I think for myself in my practice, the way I've personally defined psychotherapy is a way of interacting with a patient by looking at the narratives we've created, right? And the whole therapeutic relationship is, in a sense, using each other's therapeutic mirrors, right? So the narrative mirror to ideally, in my role, I'm helping the patient see how they've created their narrative, right? And that's the way I see psychotherapy. I think I think psychotherapy traditionally tends to have more of an approach of allowing, the person in front of you to see their own story by you being a neutral party. And the way I see that now is that it's more about the relationship you're creating, right? So one of the things that I'm big on, and I've seen in myself, and like I've seen how my own work has affected, how I show up for patients. Like one of the big things for me is also recognizing that you can't really lead someone beyond where you've gone. Right? So part of that relationship is also almost like, sharing an understanding of how I see how someone has created a narrative, right? And so I'm essentially helping them see it by knowing that I understand that I've done this process before, right? And so that for me is what psychotherapy is. It may not necessarily be the same definition across the board, but that's the way I approach it, and hence the reason why I created my approach, which is FMPI.
Yeah, I feel you're right. Most people are doing psychotherapy, they do it their own way. And for you, when you're listening, what is the right way you want to do psychotherapy? It's a good question to ask yourself because I feel like you will have different approach, and it doesn't mean that some don't work. Some don't work for you, and that's the
Mm-hmm.
toughest part. And you need to find a way to decide if the person I'm seeing is the right for me. Yeah,
Yes.
it's tough. It's tough, right?
Yeah, no, it is. And I feel like in my journey of being a psychotherapist, I've had to learn that, kind of in vitro, like it during the experience of it, of understanding that, the framework and the approach that I bring, I can only really work with people who are willing to engage it, right? And if they're not willing to engage the path that I'm learning from, because essentially, the truth is, like, if we look at any modality in terms of psychotherapy, the person who created it, that was their path. Right? Essentially, that's what they're teaching very specifically when we're talking about psychotherapy, right? And so if the person does not resonate with what I have to offer, there's no way we can work together. That is just the unfortunate fact, right? If we can't in a sense, connect at that basic playground level, then I'm not going to help a person move forward. And that has come up, I think a few times in my journey where and this is actually part of my approach as well of trying to create a horizontal relationship, right? Of like, because I think that's part of informed consent. This is what I do. Do you agree to it? And there are some people who have come, and they may not be fully consciously aware of, whether or not they fully agree to what I have to offer, but there are people who come in expecting me to do something exactly how they want it to. Right. And that doesn't necessarily work in terms of the therapeutic relationship. So I had to learn that for myself of like, it's okay if I'm not a good fit for everybody, but for those that I'm a good fit for, how can I improve the quality of my work, of what I'm doing?
Yeah, I totally get you there. It's like, and it's tough even for us when you help someone to be accepting that, yeah, it's not for everyone. And we can try our best, but sometimes it's not going to work out. And it's
Mm-hmm.
better to focus on the people where it's going to work out to do it like great. And I want to know actually how you do it and what is your methodology is about because it's like you whole have those acronym that it's like nobody is gonna know what it is. So can you
Yeah.
explain with your own word like FMPI? We put the link in the description if you want to know more in the paper. But yeah, what how does it work?
Yeah, so FMPI is an acronym for a very large concept, which is focal, neurocognitive, and physio-emotional integration. And that giant term basically is saying that this approach helps you ideally figure out a focal point. So the F and FMPI is focal, right? What direction are we heading? And it figures out essentially what all the aspects of mental health are that are keeping you from moving towards that already, right? So we're trying to figure out how to move the entire ship. And I know you mentioned my paper, and part of what I write about in there is the concept that mental health is affected by a lot more aspects than we may think, right? And a lot of it has to do with essentially our lifestyles, how we are in our life maintains how we feel. Right? So that means that there's a lot of aspects to it. And unfortunately, you know, we we can't so fortunately, I guess, we can't address one without addressing the other, but that's also the unfortunate thing. So we can make big changes in some areas, but if we don't understand the relationship that they all have for our mental health, it's really hard to move forward, right? So one of the things I think I mentioned, there was an example there in terms of when we're trying to address a condition, we need to address the underlying pattern of that condition, right? Because what ends up happening if we make a change without understanding that underlying pattern is that change might become part of the pattern again because all the areas are maintaining it, right? My main example there, if we take a simplified version of orthorexia, right? We can simplify that down to someone who thinks very rigidly. I must only do it this way, right? And at first, if we're talking about our physical health in terms of nutrition, right? For this example, and nutrition is really important for mental health. So let's just say, we know that eating salmon gives us the amino acids and the fatty acids we need to, have better mental health. But if you've decided that this is the only way, right, and I have this rigid pattern, at first the change might be beneficial, right? You're getting a nutrient that you need. But over time, if you literally only ever eat fish, or you can't see outside of that, you can't be flexible, or you're ignoring other factors because you must do it this way. Unfortunately, you've just created a situation in which this new change now becomes part of the pattern, right? So even though this may have been helpful as it started, it's now maintaining this rigid idea of this is the only way I can do this, right? So that's the important piece there. Does that make sense?
Yeah. It's like I think it's really about being holistic. if I can really summarize, because it's really interesting to frame it this way. And I feel like in today's society, it's like we talk about mental health like it's a separate thing. And where I
Hmm.
fully agree with you is like it's part of a system. And if like I was talking yesterday with someone that I'm helping, and basically she don't go out for walk. It's like you can do whatever you want. You can have the best psychotherapy, the good pills and everything. If you're not going outside and not walking outside, it's gonna be tough when you're in the depression phase. And
Yes. Yeah. Yeah, exactly. And that is what I mean, and that's part of why I created that approach. Because that's essentially what I noticed, that each of these areas of life, they essentially maintain your condition, right? So one of the other examples that I use, and I tend to use a lot even in my practice, because unfortunately it can be kind of easy to pick on. So if we take the concept of feeling as though you are an anxious person, if you tell yourself that, it is highly likely that everything that you do is coming from that place, right? So, and all of these things affect you physically. So, like, let's just say, for example, if I say I'm an anxious person, it is highly likely that and for some people this might be different, but most often it's highly likely that you're restricting yourself in many areas, right? So the simple underlying pattern is a pattern of limitation or restriction. And what that can look like is, for example, we just talked about eating. If someone tends to be anxious or believes themselves to be anxious, they tend not to have an eating schedule, right? So either forget meals or not eat sometimes, forget to eat, and then we do eat, and then maybe we overeat, right? So it's all over the board. And if we think about that just from a biological standpoint, right? What does that do to the body? When you're not getting enough nutrients and you're essentially saying, I don't know when the food's going to come. Anxiety, right? But then you'll see it somewhere else too. So sometimes we are highly likely to see that pattern of restriction in sleeping, for example, another physical thing, right? So if you've heard of revenge procrastination, right? Not sleeping because you don't want the next day to start. So if you're limiting your amount of sleep, again, what is that going to do to the body, right? If you're not getting enough rest, you're going to be dysregulated. And guess what that's going to create? Anxiety, right? And then we can take it even a step further into relationships, for example. If, again, if we're following this simple pattern of restriction, we're going to start seeing someone who feels like, yeah, I'm super anxious, I have all this social anxiety. What are they going to do? They're going to restrict the amount of time they spend with others, being with their friends, right? And again, for a social mammal, what happens when you reduce the amount of opportunity to have a co-regulatory experience with another fuzzy-headed naked monkey? Anxiety. Right? So it just continues like this simple pattern is all over the board, right? And one thing to make this a little bit more clear is you also have to understand how the brain works, right? And once it learns a pattern or once it learns a skill, it does this very scientific word, and it really is a scientific word, generalization. You can look it up. The brain does this thing called generalization, where it takes a skill and it translates it everywhere, right? It doesn't just have, a collection of neurons where we only put work stuff, for example, right? You yourself are interacting in any area of your life. And if you are telling yourself, right, I am an anxious person and this pattern is I must restrict myself, then you're going to do that everywhere. And unfortunately, just like you said, every single one of those areas that are affected by that pattern is just creating this giant positive feedback loop, right? Positive doesn't necessarily mean good. It's just causing this feedback loop of maintaining the anxious state. Because in a sense, that's what I've asked for.
yeah, it's like it's pretty basic, but at the end of the
Very
day,
simple, yes.
nobody do it. And it's what I love about this concept is like sometimes we go like so far away, and as patient, we are really like looking for like the greatest expert in this little field, which I have to wait for 1 year to get this meeting. And at the end of the day, it's like finding someone that listen to you and have this holistic approach and help you on all the different part of your life. It's probably more important than having this specific person. And I feel the way you do it is a little bit the way that I do it. I haven't thought about it in and put it in a paper like you did, but
Mm.
I talk a lot about the six pillar of health, which is exactly what you're saying, which is like sleep, hydration, nutrition, social, sport, and light.
Mhm.
It's pretty basic, but if you can fix, like most of the time, the problem you have on top, if you can fix the one under, it will solve the problem on top. Like,
Yes, the
you
domino
know what I
effect,
mean?
I call it. Yes, I know what you're talking about.
Yeah, so I'm curious about like how do you use it and talking to patient and people listening to us, like how can they improve that building of like those pillar and how to do it with because it's tough. I try every day and
Mhm.
like getting your sleep right, like doing your breathing exercise, like going to sleep at the right time, putting your mask. It's tough, and I need help. And what advice would you give us?
Yeah, so that is actually also the reason why I created my approach, right? So part of what's in there, and I mentioned this thing that the brain does, which is generalization, right? And one of the things I do is just kind of, in a sense, teach people about that. So that this framework is more about teaching a skill of how to approach your life. So, in a sense, like we were saying, the domino effect. So, in a sense, you're seeing what's starting the domino effect, right? So you can change all these areas of life just by changing what's driving you to do this in the first place. Right? So that's what I was mentioning before. Like if you truly believe you're an anxious person, you're going to constantly make that real. Because that's what the brain does, right? Let's generalize this idea and then that's where it is. So with my approach, it's more about trying to understand what lens you're looking through. And what I've noticed, and again, this is part of what I wrote in my paper. I have an example of this too. What I've noticed is that once you learn that skill in one area, so again, it doesn't matter which area you apply it to. Once you actually learn the skill and understand the relationship behind it, it's going to start again generalizing everywhere else, right? So, like for example, if yeah, if we go back to revenge procrastination, if you're doing that because you truly feel, insecure about your own self-worth, for example, so you don't want to go forward into the next day because you're worried about what other people are going to think and what this is going to happen, what that's going to happen, it's high likelihood that if you realize the core of that, like where is that coming from, and I'm able to change that, you're going to start noticing that people are actually going to start going to bed on time. And it may not even be fully conscious, right? Because what happens is you've now eliminated the main domino. There's no reason to revenge procrastinate if I now have better self worth, for example. Right? If I feel better about myself, there's no reason why I should be depleting myself of sleep. And sometimes same thing happens the other way around, right? So one of the things I do tell my patients is I don't knock any tool because at the end of the day, if we look at the research, it actually doesn't really matter. Right? What matters is that you've chosen this tool and you're aware of what it's doing for you. Just like when we opened up, right? Does this work for me or not? Am I willing to consciously make choices with this tool or not? Because the whole point, and again, I tell my patients this, the whole point is the new pattern. It's not the level of challenge. The level of challenge doesn't particularly matter, right? And in fact, I actually encourage you to figure out the easiest thing possible. Because again, it is the pattern. If you're creating a pattern of restriction, then you need to practice a new pattern, right? Maybe a pattern of flexibility. And that's actually literally it. And so when I first start with my patients, I do have a structure. So the first few sessions tend to be more structured. And it's because I'm introducing some foundational psychology concepts in order to start seeing this. right? So like I was saying with psychotherapy, whether you like it or not, whenever you're in conversation with another fuzzy-headed naked monkey, right? You're working with the narrative regardless. Like that is the juicy bits that we're working with. And in a therapeutic relationship, that's what we're doing. And one thing that ends up happening, like especially when we're talking about trauma, is that the narrative almost develops a life of its own, right? So the narrative can create your reality. It doesn't necessarily mean that it actually is literally changing the physical reality, but due to your narrative, you will change the physical reality around you based off of how you, again, behave, right? That pattern of restriction. So, what I try to do in the very beginning is I help people see how they're affecting themselves with their story, right? And start to build that awareness of, your lens. If your lens says everybody sucks and I suck, then that's how you're going to approach life. Again, it doesn't matter what condition you have, you're going to approach it from everything sucks. Which again will make it really hard to see whether or not something works for you, right? Because I can't develop trust with, let's just say, another provider, a provider that may work with me, because in my head, everybody sucks and they're out to get me. So that's actually keeping me from being able to move forward. So the very first step is looking at how are we creating our narrative? Does it belong to us even, right? Because there are some, again, just evolutionary things that happen where we unfortunately take on and learn the stories of whoever raised us. And that, we can see that's almost like a simplified version of also generational trauma, right? We do carry that. It doesn't mean we're stuck with it. It's not necessarily fate, but and even though we didn't create that mess, we didn't necessarily choose that particular lens, it's still in the way of our progress. So how can we take a step back and clean it up a little bit, right? And that's the initial structure. What is the smallest unit of this entire situation? The self. So we need to go back to it, right? Because it's about going back to the foundation, and what is really affecting our foundation is our lens.
Quick break. Can you let us review on Apple Podcasts or the platform of your choice? It really helps us break the stigma around bipolarity. Let's get back to the episode.
That's the thing which is really interesting is like it's really, as you say, it's a domino effect. It's like how can I switch my mind into believing that, if we go back to your example, like sleep is important and I love myself, so I want to sleep, so I want to go to sleep. And then
Mm-hmm.
by maybe just saying to yourself, like, every night I go to sleep at 10, only by doing this little start, you start these patterns, then will get your brain and will help you be like getting better sleep. And I think like it's really important that, because we always like, for me as bipolar, sometimes when I'm in a tough period, I'm looking like many steps ahead. And it feels tough. It feels like I'm never gonna get there. Like how I'm gonna, because I remember like one time I was in depression, I couldn't answer a text. And like thinking about even going to school, or even like, I don't know, doing something even more difficult, it was impossible. And just one thing at a time. And there's hope, like and you can do it, and you can find this one thing to do it. But the great thing is also to talk about it, like with someone like Alina, because for me it's really helped, to have someone to help you, because yeah, it's not easy to start this pattern, but then it's like it changed everything. Do you want to add on that?
Yeah, so what you're talking about there, one of the things I do talk to my patients about is realizing that a lot of the domino effects you're experiencing aren't really choices until you realize they're choices. Right? They're going to keep going until you're like, wait, I don't want this domino effect. And some of that also, and I kind of see this as a form of self-compassion as well. some of that is letting go of your perception or judgment around what you're experiencing, right? Because the more neutral we can see the domino effect or whatever's going on, the easier it is to navigate it or to move through it, right? So, like, say, for example, like we mentioned depression earlier. When you don't feel good, right? It already doesn't feel good. But if you don't feel good and you have judgments about not feeling good, like this means I suck, this means I can't move forward, this means I'm not a good person, this means I'll always be broken, this means blah, 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 right? That's going to make you feel worse. And it will be a lot harder to navigate through it. And there are some things that will create that response, and it's okay, right? So some of the examples I use when I talk to my patients, right, about this particular concept, I almost always use presentations and public speaking. And the reason why I use that, it's because the fear of public speaking, right, in the US, depending on the year, is the number 2 fear next to death in the American culture, right? Which means that almost the entire population has a huge response, like would prefer to die than to give a presentation. In general, right, for this particular culture or subset, that is a normal response. That's a typical response. Someone tells you to give a presentation, you're like, nope, gonna die now, right? I'm gonna go hide over here. And that's okay. There's nothing wrong with that. But if you don't see that, if you're unable to understand that, then you're going to see your response as abnormal. I must be broken. Look at all these things. Look at these people that can do it, right? And the reason why I use that example too is because it can be easier to see that the people who are successful at this basically just successfully understood how to navigate that fear. That's kind of it, right? That's the simple answer. I've understood that this fear doesn't have to mean I'm going to die, right? It doesn't have to mean I suck in general. It doesn't have to mean I'm broken. It doesn't have to mean that nobody cares about me or nobody likes me. It simply means that I can choose to understand how to navigate it, right? And the other reason I use that example is because, right, there is such thing as imposter syndrome. And this is what I was mentioning earlier about, understanding that it doesn't matter what tool you use. What matters is your awareness around it. Because if you decide, I'm going to heal self-worth by learning how to give speeches and navigate this fear, but you yourself aren't fully conscious of why that was happening in the first place, again, it is highly likely that you're going to use giving speeches or being a public speaker as part of your pattern, of the old pattern. Right? Of like, now I have to give 1 million speeches, or now I have to look really good on stage, otherwise I have no self-worth. You've just put it back into the loop, which is why that awareness is really, really important. And understanding that there are experiences that you have, that may be difficult, but aren't specifically unique to you, right? They may be a total normal response, right? The other examples I tend to use is startling sounds, right? Or annoying sounds. Most people are going to be startled by a startled sound. Most people are going to be annoyed by an annoying sound. But whether or not you take that to mean, something really extreme actually is up to you, right? And it's how we flow through it. And like that is, I think the more you understand that, the easier it can be to just kind of flow through phases of what you're experiencing. Because ultimately, I think one of the biggest misconceptions about, better mental health is that you will just stop feeling anything and you're just going to be Superman and just be like bright and sunshiny for the rest of your life. And the thing is unfortunately, that's not true, dude. Like you cannot lobotomize your emotions because it's a physical chemical messenger all over the body, right? So you're not going to suddenly stop emotionality. But better mental health or strong mental health or good mental health, basically the definition of it is that you can flow through any psychological state. That's what that means. So it's more about learning the skill of moving through it and letting go. Again, that idea of the lens, letting go of your judgment of it. Like this phase, I am depressed. And guess what? It's hard to reach out. But what can I do to flow through this? Right? Because I've learned about it before. And I know for me, I now go to the spa. And I go cry in the spa. And it helps me flow through it, right? It's a form of taking care of myself, even though I feel low, right? Eventually, sometime maybe today or this month or sometime in this year, I'll feel anxious. And I've learned what helps me flow through that anxiety. I've learned what helps me flow through fear. I've learned what helps me flow through my anger. Well, I'm still working on that. I still get kind of really pissed off at things. But that's the point.
Yeah, and we're all human, and it's one of the things that therapy and it helped me a lot. And I was with my psychologist yesterday, and every time I just have something new to work on because it's really about, as you say, like building patterns, building like building the domino effect and the belief that you can be better and you can do things in a way that you can improve yourself. And and at the end is like telling yourself a story you want to believe. And it's not easy to do
Mm-hmm.
that because as bipolar, we are tending to tell a self story that doesn't exist because of either we have too much dopamine and then we tell ourselves stories that are unreal, like we believe we're Superman, so in the manic phase or hypomania. And on the other way around, in depression phase, we are telling ourselves stories that are also not real, that we are the worst person in the world, which is not true also. And and it's why psychotherapy for us is, I would say, almost an obligation. I don't know many bipolar people who are stable who are not doing psychotherapy. And
Mm-hmm.
but
Yeah.
I really believe in what you say, Alina. It's really like how do you build this pattern, and it's not easy, and yeah, it's like any advice on how to get better at it because there's so many things we can do. I feel this maybe this one thing if we figure it out for us, for you, and it's like it change everything.
Yeah. And a lot of, I say the answer is just, in a sense, educating and understanding about what in a sense, the physical, real biology is doing, and also how it translate into story or narrative, right? So one of the things that I do bring in a lot, so going back to that concept of like, self-compassion through neutralizing things, right? Is recognizing that both realities are real, right? So your internal reality that is created by your story is physically for realsies. You're having a physically for reals response. That does not mean that it is an accurate reflection of the external for realsies reality, right? The external for realsies reality is actually very basic. Right? There is a thing in front of you. That's how basic it basically is. The internal reality, can be very complex because it is dependent on essentially the narrative that you're telling yourself and some of the physical things that might be going on due to your own chemistry, right? But they're not fake, right? They're both real. They're both valid, but they're not the same. And that's what I mean about cleaning up that lens and being able to recognize that. Because if I can in a sense observe myself of when I'm changing my internal reality, it's going to make it a lot easier for me to understand how to stabilize myself. And again, not necessarily dependent on the condition that is occurring. It's all about recognizing what can I do for me. And that's, going further into my approach. So one of the things that I also put in the paper are these 5 areas of balance. Right, so kind of similar to your 6 pillars. So I have the 5 areas of balance, right, that essentially help you kind of break through that, because there needs to be, like I was mentioning before, the understanding of relationship, right? Well, what am I doing here? And so the 5 areas of balance are purpose, structure, nourishment, movement, and community and or relationships, right? And all of those, again, can be applied to literally any tool. It does not matter, right? I need to have some idea of where I'm heading, right? That purpose and awareness, right? What are we doing? Some sort of structure. How do I create this pattern, right? How do I develop the domino effect towards awesomer outcome, not the one that I'm currently in, right? How do I input what is necessary? So the nourishment is how do I nourish this new pattern, essentially, right? And this can look like physical things, for example. So like if I am, for whatever reason, what just popped in my head was magnesium. If I am literally magnesium deficient, I am going to have a hard time feeling focused because I might be more dehydrated, I might be more in pain, right? All of these things. So how do I take care of that if I want to, in this physical example, maintain my sportsmanship in a way that is sustainable for me? I'm going to have to nourish myself in this way so I can keep up this pattern, right? And then movement. So output, what are you putting out? So how are you essentially keeping this domino effect going? So again, like you were saying with walking, or what I mentioned with spa, like you are going to go through bumps, but if you just suddenly stop, the pattern will fall apart. So what are you putting into it, right? And again, this can be very, very simple. This can be as simple as doing what you enjoy, right? Putting an output that has meaning to you, right? So you can bring something back in. And then the final thing is that relationship, right? And again, this can be literal physical people. Where is my community around this? Because if I'm just doing this by myself, and we've seen this, I think the example that just popped in my head in terms of, trying to change your health for the better, but no one in your family wants to. That's going to be really friggin' hard. Like, even if you have the reason to do it, you know what you need to build, you know what types of food to put in your body, you know what types of movement to do. If no one gives a shit, that can be very painful, right? And very difficult to move forward towards what you want. So that is important. It can mean the physical people. It can also mean the relationship that you have to this, right? So maybe you do have supportive people, but you believe you can't do it. Then again, it doesn't matter whether you want to, whether you know how to do it. If you truly believe, the way I do this is a way that, makes me feel uncomfortable because it's contradictory to what I feel about myself, which is I suck, you're not going to do it. And again, that's a relationship to
Yeah,
self. Like,
and you're right, because it's one of the toughest things when you're in an environment where people don't help you to change, or how do you make your environment help you to change? Most of the time, I go back to the example of walking. If your son or your friend is helping you and walking with you, then it's much easier. It's like
mm-hmm.
creating this pattern is like so much faster and easier. On the other way around, let's say someone don't want to walk and you're living with someone who is also depressed and you both don't want to walk, and or
Mm-hmm.
you're living alone, and it's gonna be tough. It's the same thing, and probably even worse with drugs, because if you are with people who are consuming, then they don't want you to change these patterns. So how it's even tougher to change it. I think drugs is easier to understand because when you do drugs, you usually want to do drugs with other people and this type of thing. It's a great conversation, but I'm seeing the time, and I guess we could do another one because we have actually talked about a subject we didn't thought about, but I think it was the most important subject for us as listeners. Last question would be like, if you had a magic wand, what would you change in mental health?
What would I change in mental health? I think I would try to change, it's actually something I'm trying to do with my provider first model, is eliminate all of the my modality is better fight. Because that's, I think, what's creating a lot of the distress in the first place, right? A lot of what, when we're talking about holistic approach, that also means working with people who may be experts in things that you're not an expert in, to have a fuller picture, right? I really do believe that mental health should be more of a team-based approach, but of different providers, right? And that's actually the model that I aspire towards, that I want to work on in my own practice. If I, build to the point where I have my own clinic, like I want a team-based approach to mental health, where we have, the nutritionist, we have the physical therapist, we have, the integrative doctor, because we all understand the relationship to everybody, and we're able to move forward, right, towards this main common goal. And I think that's what I would change in mental health care, because keeping these things so separate is actually harming rather than, bringing healing.
Yeah, it's like, yeah, it would be so great. Thanks a lot, Alina.
In my world, if I was in charge of the world, yeah.
Yeah, but we can do it little step by step, and it's why we're here also, to make this little change. Living with bipolarity often feel like a line of dominoes. One thought, one mood, one choice. It can set up like an old reaction chain. And what we learned today is it's really important to create ourselves patterns, like patterns to help us like start this first domino to help us be better and have a better life. And with Dr. Alina Soto is like we discovered that it's the most important thing is to believe in ourselves and to believe we want to change and to create this space to have these new patterns. Because if we believe we're gonna sleep better, we're just gonna start sleeping better, one step by step. So thanks a lot for listening and see you soon.
To learn more about bipolarity, go to our website, upstage.com, HOPESTAGE.com. See you soon.